Bismillah ar-Rahman ar-Rahim. It is exactly 8:36 a.m. This is News and Views on Salam Media. Welcome back. And next we're going to be talking Omicron. I think wherever you go, whatever you do, whomever you meet, this is what we're all talking about. We're worried, very especially about our children, because we're also hearing that this variant seems to be particularly affecting children 5 years upwards, even possibly below the age of 5. So let's talk with research scientist at the UCT Lung Institute, Dr. Shameem Jamdullay, about the new variant. What do scientists in fact know up to this point in time? Because generally, the whole world is scattering around, pretty concerned. We've seen the response, South Africa and lots of other African countries not being allowed access to other Western countries, and a whole host of other actions and preventative measures being taken, not only in South Africa, but internationally. So let's hope the scientists have a little more news information for us so that we can navigate ourselves safely through this space. Shameem, salaam alaikum, welcome to the program.
Walaikum salam wa rahmatullahi wa barakatuh. And thank you again for giving me that platform to educate and sensitize people a little bit more about COVID. And obviously, as you said now, what's on everybody's lips is Omicron. So let's talk about this.
Alhamdulillah, shukran for your time. Always a pleasure talking to you. So, what exactly do the scientists know up to now? And undoubtedly, there's a lot of sensationalism going out, fake news going out, and I think it just confounds us, the general public, even more. So we don't know whether we're coming or going.
Sure. So I think the main reason for psychosis that started around this Omicron was the fact that we found out that it has a certain number of mutations that exceeded what we found in all the other variants that was in circulation and that are still in circulation in some parts of the world. For example, the Delta variant. And what we know about Omicron is that it has around 30 to 32 mutations in the spike protein. And where that matters is that the vaccines that have been designed against COVID-19 infection and disease have all targeted that spike protein. So in essence, what I'm saying is that if that protein changes too much, the vaccines may not be able to recognize it. And there is a risk that there could be a decrease in the level of protection that the vaccines generally confer. But what we've also found and observed so far is that all the vaccines, irrespective of whether it's Pfizer, Johnson & Johnson, or AstraZeneca, have maintained a relatively high level of protection against hospitalization and against death. And what we also know about Omicron is that it also, there are many mutations that worry people and scientists in general, but we also know that, for example, there is that one mutation that was found in the Delta variant that made it such that it increased in its viral load and increased in its transmission through the sheer number of viruses that it could have, that it could create inside our body. So far, in terms of transmission and in terms of the efficacy of vaccines, data are still being generated. If you ask me as a scientist who've done a lot of immunology work and vaccinology work over the past 15 years, I can tell you with relatively high confidence that I don't think that vaccine efficacy will change significantly to Omicron. And when it comes to the transmissibility, right now the only data that we have are data that are being produced from what we're seeing in the Gauteng province. So it's epidemiological data, and there is no concrete biological evidence yet that this virus may be more transmissible. And finally, the last thing that we should always check with the emergence of a new variant is whether this variant can cause more severe disease. And unfortunately, so far, or rather fortunately, the people who have been infected with Omicron, especially again, as I said, in the Gauteng province, are younger people between the age of 10 to 29. So these people, we already know that they are not prone to develop severe disease in the case of an infection. So it's extremely difficult to give an answer as to whether this variant can cause more severe disease. And probably by the end of the week, when we will have a significant larger number of people within that age category that classify as possibly developing severe disease or at risk of developing severe disease, we will have an indication of whether it's more severe.
So let's look at the issue around transmissibility, which is, the numbers are rising every day. You're hearing on Saturday it was over 16,000 people who tested positive. Today we're hearing almost 11,500. So it seems as if this variant is very transmissible. You've also indicated an age group of 10 to 29 years of age, but we're hearing younger children than 10 are also being somehow or the other exposed and infected with this new strain, with this new variant. What can you tell us about that? And we also know that younger children haven't as yet been vaccinated. Do you think that that might, bring the numbers down? Although we are also told by the scientists, we're not sure if the current vaccines will give you total protection. Maybe it's only partial protection against Omicron.
So I will start by answering the last bit of your question. As I said, I am relatively and pretty confident that the efficacy of all vaccines that we're using in South Africa, be it the Pfizer or Johnson & Johnson, will still be high enough to protect our people from severe disease, hospitalization, and death. Now, when we talk about increased transmission, it is obviously related to something else or other things. And the comparison now is probably to the Delta variant. What we should also keep in mind is that the Delta variant has been in circulation in the South African community for around 5 months, if not more right now. It became the predominant variant in July, and since then, it has stayed at a relatively high level, which is above 90%. And what we know as scientists is that a variant, just like we had before with the Beta variant, will generally last in the community until it has infected the maximum number of people that it can, and eventually it will hit that wall where cases will go down, like we've seen over the past 2 months in South Africa. And what also changed between the start of our Delta variant, I don't know if you remember that the Delta surge happened around May, June of this year, and compared to the Omicron that started around 3 weeks ago, was that the level of restriction that we had were extremely different. And back then, people were also more sensitized to, like the severe disease and the possibility of even dying and infecting their own relatives and people they love. So the way they behaved was very different when the Delta variant came into the community compared to what happened in the month of November in South Africa. I mean, before I left, I'm not in South Africa anymore right now, but before I left, I could clearly remember that life was almost as if there was no more COVID around. People were going out, malls were filling up, schools were back and running as usual. And what you see now is obviously an increase in cases in what we call the most mobile part of the community, which are people who are younger because they're either going to school, to universities, or they're the working class. And these are the people who travel the most, who have the most meeting, engagement in the community or at work. And it is rather normal that you will see that this is the population group that is driving infection right now. And again, when we talk about, the possibility of kids developing severe disease or disease and being admitted to hospital in general, it is also normal that we will see an increase in that parameter because we know that the number of cases among this age group is increasing. So it is logical that you will therefore have more of these kids who are infected, and those ones who are at risk of developing severe disease or more severe disease would also increase with that. And when it comes to vaccinating kids, I think right now, what we need to focus on is to vaccinate our most vulnerable people, who still remain the older people and the one with comorbidities and many diseases, like your hypertension, diabetes, cardiovascular disease, and especially people who have a weight problem, who are overweight or obese. And yes, kids can also be vulnerable to developing severe disease, and these are the kids that also have problems. These are not your normal healthy kids who will be infected, like we've seen with Delta and Beta before, and merely develop like a headache for maybe 1 or 2 days, and then get back to their normal health. So when it comes to vaccinating kids, I will still take the conservative approach and say that kids right now should be vaccinated only if they are at risk of developing severe disease, or if they are actually staying in a household where there is somebody who could be at risk of developing severe disease if he or she gets infected. And that is the logic that I apply when it comes to vaccination. And also, this is my narrative of what's happening on the ground in South Africa right now.
Dr. Shameem Jamdullay, always a pleasure talking to you. Thank you indeed. We'll just sit back, and obviously the most sensible thing to do right now, as you've indicated, is because we were all very complacent in the month of November, we're now seeing a resurgence and a new variant. So just follow the protocols, and that is social distancing, masking up, and sanitizing. Thank you for your time. Go well, and talk to you again sometime soon.
Okay. No.
8:48 exactly. We'll be back with you in a minute or two, and we'll be talking with Liz McDade. She's the strategic lead at the Green Connection, and obviously we're looking at the issue of the Shell Oil Company and drilling off the pristine coast or the wild coast here in South Africa. So stay with us.
Osman's Taj Mahal